there are a few things to bear in mind if you're considering hair transplant surgery. And I think the person-specific things to consider is what the donor area is like. Thankfully now, a donor area is not limited to the back and sides of the scalp, which would be your typical donor area. But you must appreciate that hair needs to exist for us to move hair from a hair-bearing area to an area with little or no hair. So what your donor area looks like, I think, is really important. I'd say number two, it's worth understanding the underlying cause of one's hair loss. Because actually there's some things that cause a limited amount of hair loss and then stop, but in many conditions, one continues to lose hair. So it's important to know if one's got ongoing hair loss, and therefore any surgery that's undertaken can be planned in advance. So again, maybe all I'm saying is let's understand the underlying diagnosis. There isn't an age limit. There isn't an upper age limit for a hair transplant surgery per se. However, I think it's important not to do it way too early or when one's too young. There are limited cases in children where a hair transplant might be appropriate, but it's by no means the first thing to be recommended. But again, like with adults, it's important to understand the underlying cause of hair loss in the first place. There are quite a few things to consider, so it's always worth just getting an appointment to have an assessment for yourself and to make sure the cause of your hair loss is understood and a bespoke plan created for you. Well, we need to move hair from an area with hair to an area without hair, just simply put. So with this, it's carried out as a day case procedure and it's under local anesthetic. So the area is numb, and therefore you shouldn't feel any pain, but you might feel pushing and the sense of pulling as well. And basically, there's so many techniques to use, but I like to use a more modern technique using a fine needle where we'd move hair from an area with hair and move those individual groupings of hair from the site, from the donor site to the area where you'd like more hair. It is. In skilled hands, I'd say absolutely it is. Obviously, the things to that your doctor, your surgeon would take into consideration first. Like any existing or pre-existing medical conditions need to be taken into account and planned for. But a hair transplant is commonly carried out and safely carried out by skilled surgeons in the UK. So I think the simple answer is yes, but this wholly depends on what the underlying cause of hair loss is in the first place. Most people lose hair for a combination of reasons, and this is males and females. In males and females, they can lose hair for a combination of reasons. So if the underlying cause is not understood, one may have an ongoing medical issue that needs to be addressed. And then we look at common causes of hair loss, the androgenetic hair loss, also commonly known as male pattern hair loss or female pattern hair loss. In that, the extent of it is not easily defined. So you can look at one family and find that one person's completely bald and another sibling within the same family is not. So I think what we've not quite identified is how far one's hair loss will go. One individual person's hair loss will go, but we take family history into consideration. So if one's got ongoing hair loss that's not addressed, so if the correctables have not yet been corrected, a hair transplant surgery will fill gaps that exist, but it doesn't do anything for the underlying cause of the hair loss. So I know I sound like a broken record, but hence it's important to understand the cause of the hair loss so you can treat anything that's treatable. But hair transplant surgery is brilliant, or shall I say, can be brilliant for filling any gaps that exist in your hair. So hair transplant surgery can offer a brilliant solution in most people, actually. So, however, the underlying cause of the hair loss needs to be taken into account. So, in male pattern, or I should say androgenetic hair loss, hair transplant surgery can be a brilliant way of treating that. So filling the gaps that exist, and with success rates over 90, 95, 97% in some cases. However, with underlying conditions like scarring conditions, that success rate varies. But in patients like that, what we do is do a trial procedure where your individual success rate can then be identified. So what do I mean by that? Say we take 50 to 100 grafts, place it in a particular area on your scalp, and then we come back down the line, take a look at that and see what percentage of that is grown. So it requires patience. However, you will then know what your personal success rate is likely to be. But yeah, this is something that I do with some of my patients. But it's a procedure that actually is brilliant for certain conditions, but identify the right patient in the first place is important.